Welcome back to RAM's MBBS studies. Today we will learn about reflexes. Topics that covered in this PPT, Reflex definition, types of reflexes, grading of reflexes, instruments used that we used in reflexes, root value, mnemonic, methods of elicitions. Reflex is an involuntary response to a sensory stimulus. Mechanism of reflex generation. Afferent impulses arising in a sensory organ produce a response in the effector organ. The response can be sensory, motor, or autonomic. Types of reflex. 1. Deep tendon reflexes, monosynaptic reflex. 2. Superficial reflex, polysynaptic reflex. 3. Plantar reflex. 4. Latent reflex. 5. Primitive reflexes. 6. Inverted and perverted reflexes. Grading of reflexes. 1. Absent reflex, even after reinforcement. Guard 0. 2. Present but diminished. Equals grade 1 plus. 3. Normal. Equals grade 2 plus. 4. Increased but not necessary to pathological sign. Equals grade 3 plus. 5. Markedly hyperactive, pathologic, often with extra beats or accompanying sustained clonus. Equals grade 4 plus. Instruments used in reflexes are, 1. Tromner neurological reflexes. 2. Taylor hammer. 3. Babinski neurological hammer. 4. Queen square. Reflexes and root values. 1. Biceps C5-C6. 2. Supinator C5-C6 radial nerve. 3. Triceps C7-C8 radial nerve. 4. L3-L4 femoral nerve. 5. Ankle S1-S2. Few other spectral C5 to T1 finger flexion C6 to T1. Biceps reflex. Press the forefinger gently on the biceps tendon in the antecubital fossa and then strike the finger with the hammer. Normal response, flexion of elbow with visible contraction of the biceps muscle. Supinator reflexes. Strike the lower end of the radius about 5 cm above the wrist and watch for the movement of forearm and fingers. Normal response, contraction of brachioradialis and flexion of elbow. Triceps reflexes. By holding the patient's hand, draw the arm across the trunk and allow it to lie loosely in the new position. Then strike the triceps tendon 5 cm above the elbow. Normal response. Extension of elbow with visible contraction of triceps muscle. Knee reflexes. For right-handed examiner, the left arm is under both the knees in order to flex them together and tap the patellar tendon lightly on each side and compare the movements of lower leg and of quadriceps muscle. Normal response. Extension of the knee and visible contraction of the quadriceps. In case of lower leg amputation, keep finger just above the patella with legs extended and strike it in peripheral direction and look for upward pull of patella. Ankle reflexes. Patient's leg should be externally rotated and slightly flexed at the knee. Examiner uses the left hand to dorsiflex the foot. For the left leg, move to the other side of the bed. The Achilles tendon is then struck. Normal response. Plantar flexion of foot and contraction of gastrocnemius. Clonus reflexes. Series of involuntary muscular contraction induced by a sudden passive stretching. Superficial reflexes. Corneal, lightly touching the upper cornea. Abdominal, stimulus by stroking cremastic, Upward movement of stroking anal reflex, contraction of sternus and sphincter bulbocavernosus, contraction of nose sphincter. Plantar reflex. Stroking the plantar surface of foot from the heel, normally followed by plantar flexion of foot and 2. Babinski sign. It is the pathologic variation of plantar reflex, LE. Plantar response. It is part of primitive flexion re. Higher vertebrates, the flexion response includes fest, hip, flexion at knee, and dorsiflexion of ankle.